I'm Rocky Merchandani, Vice President of Community for Dow Jones, and I'm joined today by Ash Shehata, Principal of the Global Healthcare Center of Excellence at KPMG. Ash, thank you for joining us today.
It's a great pleasure to be here, Rocky. Thank you.
We've got 5 minutes, so I'm going to hop right into it. For our first question, I'd love for you to talk to our audience about deglobalization and what it means.
Well, Rocky, deglobalization has kind of two aspects to it. There's a political aspect and there's an economic aspect. I'm going to cover the economic primarily. What it really is about is always finding the most efficient place to manufacture or source a good or a product. And it's also being able to do that kind of at the private industry level, making those decisions and being able to kind of look at countries across the globe in different criteria, but being able to make those decisions for the sourcing and the capability pricing of your product.
Ash, do you believe that the deglobalization trend has been in the making for some time and only accelerated through the pandemic and now also with the increased geopolitical instability?
It's a great question. This has been a long journey here. I think back even in my career, we started deglobalization for technology capabilities over 20 years ago. So it's taken us, decades and decades to get to the point we are now. I would say the deglobalization discussion may take us several decades as well to get to a different place than we are now. And there are three areas I always like to think about when we think of deglobalization. One is really looking at the pricing. We talked a little bit about that. The second one is also being sensitive and aware on some of the newer things that we're looking at in the world today, for example, ESG. And then the third one, which is I think really important when we look at global tax and global reorganization between the G20 and the OECD, is how are we going to look at this kind of world economy looking forward? So I think as we kind of think of where we've been and where we're going, those are the considerations that we need to kind of put on the table now.
What are the shorter and longer term implications of deglobalization? And Ash, how can organizations in the healthcare ecosystem look at this as an opportunity versus seeing it as an impediment?
No, it's a great question. And I'd say, as I talked about before, those kind of the three drivers, price and some of the social sourcing and ESG, those are the things that are going on in everybody's mind. So short term, I do think there is going to be a consideration around more volatility in pricing and supply chain. And I know it's hard to believe that that can be the case, but more volatility is definitely, I think, in store for us right now, and we need to prepare for that. The second thing, if we kind of agree that that's going to be the case, we do need to start looking at alternatives. And even though some of those alternatives, especially in life sciences and healthcare, may be uncomfortable because we've spent so much time kind of reassuring and rebuilding and fortifying these supply chains, it is uncomfortable to say, where's my black swan moment? But we need to prepare for that now. And we need to begin to kind of have those discussions and honest discussions. And the third one, which I think a really important one, is we need to kind of begin to explore some of these options with our clients, especially the ones who are very price sensitive. Because in order to get that right balance of price and quality and price and sustainability, we have to have an honest dialogue about it. So that's short term. Long term, the opportunities are immense. I mean, really creating a sustainable sourcing model that isn't just about low price, but really building, capabilities in markets and countries across Europe, Asia, ASPAC, and the Americas. That's a much better world order, and I think one that we all like to see. The second area that I think long term is going to be exciting for us is really being able to create a better dialogue with our clients and our customers, because this is a journey that we're going to be on together. And it isn't just a one-way transaction, it's a two-way agreement. And then finally, I think the third one, this is a chance and the moment to really build those relationships with boards and management and relationship to have these discussions. So it really is about, we talk about sustainability and so many things in our world today with energy and quality of life. This is going to be one of those things. And I think healthcare and life sciences as a critical industry is primed for this discussion right now.
Well, thank you so much, Ash. That's the time we have today, and I really appreciate you joining us for this conversation.
Rocky, it's been a great pleasure. Thank you so much.